I want to shift gears slightly and for the next segment, want to offer a brief video that Dr. Gus Parker has provided for us, talking about Novant's recognition of the same basic concern that Dr. Baumfolk just recognized. The system is not just, it is not fair, and we need to do much to change that system.
Experts have started to compare the approach of healthcare in American communities to a fish pond. Imagine knowing that the fish from this pond are always sick, and they don't live as long as fish from other ponds. Imagine that there's a clinic on the edge of the pond that fish go to for treatment. Their care is excellent, and they leave healthier. But when they leave, they go right back into their toxic pond, and they enter a cycle of illness and treatment. In this pond, there is very little chance that the fish will ever move into a healthier environment. The fish are tired, they're frustrated, and they're sick, and the clinic is financially stretched, all because of the toxic pond. So then, why is no one treating the pond? We all know this doesn't make sense. If we wouldn't do this to fish, why are we doing this to our neighbors? Unfortunately, this is the model of healthcare in America. U.S. neighborhoods, our ponds, are largely segregated by race and socioeconomic status. Access to basic social needs like housing, gainful employment, educational attainment, safe neighborhoods, healthcare, and transportation are largely determined by where you live and impacted by your race. At Novant Health, we are asking ourselves and our partners the question, why wouldn't we treat the pond? We have to imagine something better, a new healthcare landscape that breaks old cycles and addresses these root causes to illness through a lens of social justice. Let's imagine better. Imagine a community-wide transformative approach that honors the voice of community members, linking together policies and partnerships to address social injustices and racial discrimination at the local level. Imagine a comprehensive approach that emphasizes prevention and aligns commitment, passion, and resources from key community assets to have a meaningful impact. Imagine better with us. We envision a new model of upstream care that transforms health through social justice. We are focusing on access to care, food, housing, and workforce development to achieve community transformation. This means stepping outside of our four walls to provide services with and within the community, honoring the power of community voice and activism. How will we do that? We'll use data to identify the neighborhoods in our footprint that have the greatest need. Our community health advocates are recruited from within these neighborhoods because they know their community best. They're trained in health equity and trauma-informed care. They'll work inside trusted community locations to provide advocacy, health education, and support for their own neighbors. And they'll utilize our established partnerships in food, housing, and workforce development to provide their neighbors a real chance at upward mobility. We'll expand from individual impact to the broader community and social environment, providing mobile access to critical preventative services like mental health assessments and immunizations from within the neighborhood. We'll expand our existing work to place food pharmacies inside of clinics in known food deserts. And we'll support community members on initiatives they find vital, like resident-owned grocery stores. We'll continue our annual investments in affordable housing for neighbors in need, and expand our work to build career pipelines, supporting investments in technology careers and pathways for career progression in healthcare. We know no two ponds are exactly the same, and we'll customize our approach to what each community needs most. We're not creating just another program. We're using Novant Health's convening power to bring together community members and partners to accelerate change so we can move further, faster together. These efforts will result in a powerful social return on investment. We can improve chronic disease management, health outcomes, and quality of life for our neighbors. Together, we can lower unnecessary costs for our healthcare system and decrease the burden of government to provide public services. And together, we will improve upward mobility and economic opportunity, transforming communities into places where we don't have to imagine health equity. We can actually experience it. Join us as we imagine better.
Thank you so much for sharing that video, and I appreciate Novant's healthcare system looking at systemically what it is that we need to begin to do to change the impact on communities of color.